Y'all ready for that surgery exam this week?
Such a busy week. CJ, is this your bag?
No, I already had my lunch today.
Mm-hmm.
Is it anybody's?
No. Those farm students leave stuff everywhere.
They
They
do.
really do. Should we look in it just to see?
You think
I'm
we should?
curious.
Yeah, I'm nosy. Oh. Looks like it's some dolls.
Dolls.
Dolls? Oh, Ryan, this one kind of looks like you. Shakina.
Ooh. My little twin.
You know, I remember I used to play with action figures when I was younger.
What a time. Do you guys ever wonder what it would be like to be a doll? Like, what are their lives like?
Would our lives be
Probably
easier?
less
stressful than ours right now?
Yeah, not worrying about exams, just looking cute every day. Let's be
Oh.
honest.
I wonder.
I'd like to be a doll right now.
Me too.
Agreed. What's this? Hold on, let's check this side. No, I have to get this checked out. God. Okay. Let's hurry up.
Come in.
Hi, my name is Summer. I'm going to be the PA taking care of you today. Can you confirm your name and date of birth?
Jasmine, January 1st, 1993.
Okay, Jasmine, and what seems to be your concern today?
I have a lump in my right breast.
Oh, how long ago did that start?
Like 2 weeks ago?
And have you noticed any pain?
No.
And what does the lump feel like?
Like, it's just hard. It's not moving or anything.
And is it just in one breast?
Yes, just the right.
Okay, and what made you notice this?
I was just doing my self-evaluation in the shower, and I just felt something unusual.
And about how big is it?
I don't know, maybe like 2 centimeters?
Is it movable or is it pretty stable?
No, it doesn't move.
Have you noticed any nipple discharge?
Actually, yeah. It's like clear though.
Okay, and have you had any nipple retraction?
Yeah.
Has your breast had any kind of other skin changes?
It's been like flaky and dry. And like there's like red around the nipple area.
Oh, I understand how that might be concerning.
Yeah.
I'm glad you came in today. Have you noticed any increase or decrease in the size of the lump since you found it?
No.
All right. Have you had any fevers?
No.
Any recent weight loss?
No.
Any fatigue?
No.
Okay. Have you ever been pregnant or are you currently pregnant?
No.
When was your last menstrual period?
Like 3 weeks ago?
And how is the flow?
It's pretty heavy and then it gets lighter. It lasts about 5 days.
About how many tampons do you use on your heaviest day?
I use like 4.
And do you have any symptoms with your menstrual period?
Like cramps or headaches or anything?
Yes.
Yeah, I kind of have like mood changes. I have headaches and sometimes I get a backache.
Okay. Do you have any family history of breast cancer in your family?
Actually, yeah. My grandma on my mom's side, she had breast cancer. She died when she was 67.
Oh, I'm sorry to hear that. How about family history of ovarian cancer?
No
What
ovarian
about
cancer.
what about cystic breast?
No, we don't have that either.
Has anybody ever told you that they had PCOS?
Actually, no, I've never heard of that.
Okay. Okay. Do you mind if Oscar, the objective specialist, comes in and does your objective exam for you? I know it's a man, and sometimes people don't want that, so I always want to check just to make sure ahead of time.
As long as he knows what he's doing, that's fine.
Yes, he is completely capable.
Okay.
All right, he'll be right in with you, okay?
Thank you.
Hello, ma'am. My name is Oscar. I'm here to take your vitals and do a physical exam on you. Is that okay?
With that?
We're just going to get your temperature.
Oh boy. Okay.
All right. Okay, now that we got the results from the physical exam, we're going to take you down to radiology Rachel.
Hi, I'm Radiology Rachel. We're going to go ahead and get a breast ultrasound of your right breast, and we're also going to get a bilateral mammogram done. Can you just verify your name and date of birth for me?
Jasmine, January 1st, 1993.
Perfect. So we're going to go ahead and get those underway. Do you have any questions?
No.
All right, let me go talk to my preceptor and see what he thinks. I'm not quite sure.
Hello, Dr. Drax. Today I have a patient with a 31-year-old African-American female with a past medical history of hypertension and family history of breast cancer, presenting today with the concern of a firm lump in her right breast. She first noticed it 2 weeks ago during a self-breast examination. The lump is small in size, non-tender, and immobile, and has not increased, decreased in size since found. She reports she has a small amount of clear nipple discharge, slight nipple retraction with flaky, dry, and red skin around the nipple. She hasn't tried anything to alleviate. Patient reports the menstrual cycle ended 1 week prior to finding the lump. No other lumps found in either of her breasts. She denies any fever, recent weight loss, fatigue, skin changes elsewhere, lumps in neck, cough, dyspnea, difficulty breathing, nausea, vomiting, increased work stress, depression, or difficulty sleeping. So as I said before, she has a past medical history of hypertension and anxiety. She takes lisinopril 10 milligrams POQD and cetrizine 10 milligrams POQD PRN for allergy symptoms. She has seasonal allergies with sneezing, watery eyes, rhinorrhea, but she denies allergies to any medications, environmental, or food allergies. She denies any hospitalizations or surgery. She did complete her COVID and flu shot, as well as her Gardasil when she was 12 years old. Her last Pap smear was about a month ago, which showed no atypical cells, HPV negative. She also had STI testing done at the same time, which were all negative. She denies any imaging done of her breast prior. She is GOPO. Last menstrual period was about 3 weeks ago. She has a heavy flow the first day and tapering off until day 5. She uses 4 tampons a day, and she has mood changes, headaches, and backaches associated with her cycle. As stated, she has a family history of breast cancer and her maternal grandmother who died at age 67 of breast cancer. She denies family history of ovarian cancer, PCOS, and cystic breast. She is a physician assistant in a primary care clinic. She denies smoking. She occasionally drinks wine with her friends. She is sexually active with one partner, participates in vaginal and oral sex, and she uses condoms at birth control. She has no concerns today for any STIs. For her objective data, her vitals are 118/80, heart rate 72, respiratory rate 16, temperature 98.6. She is 5'8", 150 pounds, BMI of 22.8. For general, interactions are normal and appropriate. She is pleasant, cooperative, and answers all questions appropriately. She is well-developed, well-nourished, and appears to have a normal affect. All of her other physical exam findings were normal, except for in her breast on the right side, she had one firm, immovable, non-tender, palpable mass, about 2 centimeters in diameter in the upper outer corner of the right breast. She also has some skin around the breast, appears scaly and flaky at the site. She also has some erythema, nipple discharge, and nipple retraction noted. She also has some lymphadenopathy in the right axilla. The left breast does not have any of these problems. So the diagnostic testing I ordered, we got a breast ultrasound, which showed a suspicious solid mass in right breast, a bilateral mammogram, microcalcification clusters in right breast. So as I said before, she is a 31-year-old African-American female with past medical history of hypertension and family history of breast cancer, presenting with firm, non-mobile, non-tender 2-centimeter lump in the upper outer quadrant of the right breast. She has peau d'orange skin at the site of the lump with erythema discharge and nipple retraction. Her left breast does not have these signs. Mammogram and ultrasound performed showing suspicious mass. This is leading me to my most probable diagnosis of invasive ductal carcinoma. Of course, we won't know until we refer her for a biopsy, which I think should be our next step. Yes, that sounds very good. Go ahead and send the referral now and go ahead and talk to the patient about this diagnosis. Okay, thank you.
Hello, Jasmine.
Hi.
So I have the results of your ultrasound and your mammogram.
Okay.
So your breast ultrasound is showing a suspicious solid mass in the right breast, so that's probably what you were feeling.
Mm-hmm.
And then your mammogram shows some microcalcification clusters in the right breast.
What does that mean?
So at first, I was thinking that, maybe this lump is a fibroadenoma, which is very common in young women. But fibroadenomas are typically mobile, which you had said that yours was pretty stable and immovable.
Okay.
And then when we did your mammogram and ultrasound, the results for a fibroadenoma would show a clear, well-defined edge, but your imaging does not show that.
Okay, so it's not a fibroadenoma?
Correct.
Okay.
And then I also was thinking maybe it's just a breast cyst. Sometimes that's common,
Mm-hmm.
but cysts are usually painful and at least a little bit tender.
Yeah, this wasn't painful at all.
Yeah. And then your ultrasound would also show a fluid-filled cyst,
Mhm.
but the imaging indicates a solid mass.
Right.
So the last case that we're coming to is that this has the possibility of being invasive ductal carcinoma.
Carsa who? What?
So due to your positive mammogram and ultrasound showing a suspicious mass, we're suspicious that this may be invasive ductal carcinoma, which is a form of breast cancer.
What? For breast cancer? No. No, 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 no.
I will allow you some time to process this in your own time. Do you have any questions?
I'm 31. I went to PA school. I lived my life. And you're telling me I have breast cancer?
So it's not 100% certain right now because we haven't gotten a biopsy or any kind of surgery. But right now, that's just what that's what we're leaning towards.
Okay, what do I do next?
So if you're ready to listen to some treatment options in the next step, we do have Treatment Tyrone here to assist you. Just let me know when you're feeling a little better.
Oh my God. You said it is cancer or you think it's cancer?
So it is suspicious of cancer. However, we won't know until you go through with the next steps.
Okay, where's Tyrone? Tyrone!
Okay, I'll go get him right now for you, okay?
Hi, my name is Treatment Tyrone, here to save the day.
All right, Tyrone, what's next?
So first, what we're going to do, we're going to refer you to oncology and surgery to get a biopsy.
Okay.
All right. Depending on your biopsy results, the oncologist will discuss your treatment options. It's very important to adhere to follow-up appointments and their plan. We will follow up in 1 week to review your biopsy results. And for any signs of infection and pain, return immediately.
Okay, sounds good. Thank you.
You're welcome. Tyrone out.
Okay, now that you've heard all of these next steps, do you have any questions?
Okay, but you know how it is as a PA. I rarely get a day off. What am I supposed to do about work?
So you know how we fill out those FMLA forms all the time for our patients?
Mm-hmm.
Well, they also apply for us too. So because of the FMLA, you're guaranteed 12 weeks of time, unpaid time off, protection.
Okay. Okay, and is this genetic? Is this affecting my family at all? Should I be concerned about my sisters, my mom?
So there are some studies that suggest that breast cancer is familial and you can inherit it. So Salisbury offers genetic testing for those who are at risk for breast cancer. The clinics can get a sample of saliva, detect the gene BRCA to see if it is present.
Okay. That's all I can think of right now, but I'm sure I'll have more questions later. Is it okay if I call you or?
Yes, of course. Reach out anytime.
All right, thanks. Sheesh. I guess dolls really don't have it easy.
Yeah, really.
Yeah, no. You know what? I actually kind of like being a PA student.
Let's get back to studying.
Yeah.